All right, so the first thing we're gonna do is we're gonna look at her toe touch. So I want actually feet a little wider than shoulder width, toes straight ahead. Now it's important we get those toes straight ahead from the assessment piece because we want to be consistent with our screen. And so if you tell people you can toe out a little bit, well, what's a little bit? I can't really define that. So we just always want to tell them toes have to be straight ahead. So she's going to go down and touch her toes. Okay, good. So I'm looking at a posterior weight shift. Her hips are behind her heels, which is where I want to see. She can get down to her toes. She does have a little bit of a knee bend, but I'm okay with that. She's gotten down to that position. We've got a pretty good lumbar curve here. So she looks good there with that hip hinge. So now I'm going to have her drop into a squat as far as she can. Okay, and here's where we're going to see. This is similar to where we're going to see with a lot of our patients and our clients. I want to see her get her butt down on her heels. She can't get down there, right? So she can grab onto her feet or insteps and pry herself down a little bit if she can, but that's as far as she's going to go, okay? Now from here, I'm going to have her rotate one arm open and rotate open. That actually looks pretty good. I'm going to have her turn here in a minute and do the other side so you can see it from another angle. Go ahead and rotate open this side. So the thoracic rotation is good even though her squat isn't so good. Now go back down. Now from here, I'm going to have her raise her hands up. And her hands are obviously not behind her toes, and she's going to stand up out of it, okay? So the ascent isn't that bad. Her timing was decent. She just can't get into the position that we want her to get into. So let's go through that one more time, just kind of in real time, real speed. So go ahead and bend down, touch your toes. Okay, that looks pretty good. Go down, drop into a squat. Oh, that's all the further she can get. Okay, now she's going to rotate open. Other side. Good, I'm seeing decent thoracic rotation there. Now hands up, go back, yep, there we go, and then stand up out of it. All right, good. So let's turn 90 degrees so you face them so they can see this, and we're gonna go through the same thing. So toes straight ahead. Good, so we wanna look at this from different angles so we can assess everything here as well. So go ahead and touch your toes. Okay, good, now drop your hips. Okay, now I want you to see the rotation. So she's gonna rotate open as far as she can. Notice how she gets good rotation here. So we're good there. Other side. Good. Now hands up and stand up. The other thing I'm looking for on this angle is, does she have a weight shift side to side? And she looks pretty good there as well. So when I look through our assessment here, now we've got these different criteria. Hips behind the feet, hands touching toes with slight bend in your knees. So this is a great sort of cheat sheet for you as you go into these exercises, these movements. This is what we're looking for. These are the criteria with all these different areas. Our deep squat, our hands between the knees. Our hips are below the knees, which she couldn't get there. Our toes have to be straight ahead. A lot of people want to toe out at that position. Thoracic rotation, our hips should not rise and our arms should be near vertical or as near vertical as we can get. And then the overhead squat at the bottom, our hands are behind the toes, our trunk and tibia are parallel, and the toes are straight ahead. And then the overhead squat with the ascent, our trunk and tibia are parallel, and the hips and chest move at the same time when they ascend out of the bottom of the squat. So this is a great slide here that you might want to highlight. So as you go back through this movement screen, these are the checkpoints you're looking for as you start to move through this. And so here's just breaking it down a little bit again. So the start and the position one is the hip hinge, and then the deep squat, and then the thoracic rotation, and then the deep squat at the bottom, and then the ascent out of the bottom. So here is our sheet that we talked about, that we have here for our grading sheet. As I look at this, her hip hinge is good. So I would give it a check. She's good there. Her deep squat, not so good. So I'm going to leave it blank. And that's just going to be my notation that she struggles with the deep squat. Thoracic rotation was good on both sides and was symmetrical. So she gets 3 checks there. The overhead squat at the bottom was not good. So I'm leaving that blank. And then the ascent was actually pretty good. It's a little bit deceiving to look at because she had trouble getting to the bottom position. But the way she comes out of her bottom was actually really pretty good. She came out with good timing and good sequencing. Now, as I look at that, just to break this down a little bit, I want to be careful not to jump too deep into this because it's easy to really nitpick this apart and try to turn a screen into an assessment, and that's not our goal. I'm not trying to diagnose anything, but some possible things that I see with her that are problematic is she may have an ankle dorsiflexion restriction. Now, when we get into some other movement patterns, that's going to show up if that's the case. But she might have a hip restriction. Again, I'm going to find that in other of our movement screen processes here, my other movement patterns. I'm going to see that if that is the case. More than likely, when I look at her, my guess is she just doesn't know how to squat. We need to redefine that movement pattern. And it doesn't necessarily that she has all this dysfunction or these mobility restrictions. She probably just doesn't know how to do it. She doesn't have that proximal stability to allow for that distal mobility. So I say that because I hear a lot of people, a lot of coaches say, well, she can't squat because her ankles are locked up or her hips are really tight. I'm not sure that's the case based on what I see here. And that's why we have to continue with this process. We don't want to just look at the squat because it's a very complicated movement. When you look at an overhead squat, it requires full triple extension of the upper extremity and full flexion of the lower extremity at the same time. That's asking a lot of the brain and the nervous system. So we don't want to look too much into this yet. We need to go through the rest of this process before we start to figure out what we think is wrong with her. But most people that I see, it's really a movement pattern problem. They don't have the train track set up, and that's where we want to go with our corrective exercise.